Okay, I'm Lindsay Broaddus, and today I'm going to be doing my neurological assessment. First, I would start with hand hygiene, and then I would introduce myself. Hey, I'm Lindsay Broaddus. I'm a student nurse at the University of South Alabama, and today I'm going to be doing your neurological assessment. Is that okay?
Mm-hmm.
Okay. So first, we would start. I'm going to be looking at your appearance. You're well groomed. Your hygiene looks good. Your posture is erect. And next, I would move on to your behavior. You're smiling at me. He is alert and oriented. Are you having any issues of depression or anxiety lately?
Mm-mm.
No. Okay. Well, if you were, I would get the appropriate screening tools for this. Now I'm going to move on to the cognitive function. So, what's your name?
Isaac Harrell.
Okay. Where are we?
Home.
Okay. What time of day is it?
Nighttime.
Okay, good. Those are all correct and true answers. Now I'm going to test your recent memory. I brought you in a tray of food for breakfast, and I can tell you. Can you tell me what was on your tray this
Biscuit.
morning? Okay, I brought his tray in this morning, and he did eat his biscuit, so I can verify that. And then next, I would move on to the remote memory. Who was the president before Donald Trump?
Barack Obama.
Okay, that's good. That's true. Now I'm going to test your thought process and perception. I'm going to check your reasoning. And the first thing I'm going to check is your abstract thinking. If I say it's like finding a needle in a haystack, what does that mean to you?
Hard to find.
Okay, good. That's right. And then next, I'm going to test your judgment. If you were driving down the street and saw blue lights behind you, what would you do?
Pull over.
Okay, good job. That's good judgment. And where do you expect yourself to be in 2 years?
Still married. Still at the same job.
Okay, good. That's realistic and that is true. So now I would move on to the cranial nerves. Now I'm going to assess your cranial nerves. I'm going to begin by assessing cranial nerve 1, the olfactory nerve. First, I'm going to assess the motor function. I'm going to have you close one side of your nostril, sniff. Okay, the other side. Okay, good job. And that's the motory portion. And the motory portion of cranial nerve 1, the olfactory nerve, is intact. And now we're going to move on to the sensory part. For the sensory, I'm going to grab 2 smells. So if you'll close your eyes. Okay, I'm going to grab my 2 scents. If you'll close one of your nose holes. Okay. Smell that.
Smells like alcohol.
Okay, good. That's right. Keep your eyes closed. And if you'll cover the other nose. Let that go. Smell that.
Peanut butter.
Okay, good job. Those are both correct. Set those down. You can take your arm down and open your eyes. Okay, so the sensory portion of cranial nerve 1, the olfactory nerve, is intact. Next, I would go to cranial nerve 2, the optic nerve. Normally, I would use a Snellen eye chart, and you would stand back 20 feet, but today we have a handheld vision screener, and I'm going to do it 14 feet away. So, and if you'll cover one eye, and if you'll read the smallest line possible.
The numbers?
Yes.
374258.
Okay. So your vision is 20/30, which means you see at 20 feet what a normal person would see at 30 feet. Normally we would do this bilaterally, but for today's sake, we're just going to do the one eye. And then next, I would do cranial nerve 3, the ocular motor nerve, using something called Perlac. So first, I would inspect your pupils. If you'll just look at me, so I can rate your pupils, and I'll say they're about a 4. So that's good. And then next, I would see if they make sure they are equal and round, which they are. They are equal and round. And then I would go on and see if they are reactive to light. Okay, so if you'll just look at me the whole time. Okay, it is reactive to direct light, And now we're going to see if it is consensual. So we're going to do it one more time. And yes, it is consensual. And then next, I would move on to assess the pupil accommodation. If you'll look at the front door. Okay, they dilated. And if you'll look back at me. Yes, they constricted. So they do have pupil accommodation. And next, I would do convergence. So if you'll look at this and just move your eyes and follow it. Okay, they did turn on an axis, so they did converge. And then next I would again state that I did Perlac, and the pupils were equal, round, reactive to light, accommodated, and they converged. And that means the cranial nerve 3, the ocular motor nerve, is intact. Next I would move on to cranial nerve 3, the ocular motor nerve, the cranial nerve 4, and the trochlear nerve, and the cranial nerve 6, the abducens nerve, by testing your extracurricular movements. I'm going to have you follow my pen light and don't move anything else but your eyes. Okay, so. Okay. Parallel tracking was noted, and there was no nystagmus noted. So with that being said, cranial nerve 3, 4, and 6, the ocular motor, trochlear, and the abducens are all intact. Now I'm going to assess cranial nerve 5, the trigeminal nerve. If you'll clench your jaw tight for me. Okay, I'm going to palpate. Okay, good. And I'm going to pull down, and you just resist from me. Okay, good. And now if you'll close your eyes, and I'm going to do the sensory portion of cranial nerve 5, the trigeminal nerve. Just say now when you feel me touch.
Now. 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 Now.
Okay. And for the sensory portion, we would normally put something sweet or salty on the anterior 2/3 of your tongue, but today we're not going to do that. So the cranial nerve 5, the trigeminal nerve, is intact. For cranial nerve 7, the facial nerve, first I'm going to assess the motor function. I'm going to get you to make some funny faces with me. If you'll smile, frown, if you'll puff out your cheeks. Okay, raise your eyebrows. Okay, and squint and close your eyes together, and this may be kind of tricky. And I'm going to pull them apart. Don't let me pull them. Bilaterally. Okay, good job. So the cranial nerve 7, the facial nerve, the motor response is intact. To check the sensory portion, we would normally put, I said that for the trigeminal part, but that is actually for the cranial nerve 7, the facial nerve, that you would put something sweet or salty on the anterior 2/3 of your tongue. But we're not going to do that today. Now I'm going to assess cranial nerve 8, the acoustic nerve. So if you'll cover one of your ears, and I'm going to whisper something, and you just repeat back to me what was said. Jaguar. Did you hear it? Jaguar.
Jaguar.
Okay, good. Now if you'll cover the other ear. Okay. Nursing.
Nursing.
Yep, good job. And that is the cranial nerve 8, the acoustic nerve. And then next I would go to cranial nerve 9, the glossopharyngeal nerve, and cranial nerve 10, the vagus nerve. I'm going to test these together. First I'm going to have you open your mouth wide, stick your tongue out, and say ah. Okay, good. The uvula is midline and it rose on phonation, so they are intact. And then next I would normally take a tongue blade and do your gag reflex, but we're not going to do that today. So the cranial nerve 9 and 10 are both intact. So for cranial nerve 11, the spinal accessory nerve, I would have you raise your shoulders. Okay, don't let me push them down. job. And then next, I would move your face. If you'll turn your face towards here, okay? Other side. Good job. And then the cranial nerve 11, the spinal accessory nerve, is intact. And then next, I will move on to cranial nerve 12, the hypoglossal nerve. I am going to have you stick out your tongue. Okay. And I need you to say, well, while you're sticking out your tongue, I need you to say light, tight, and dynamite while sticking out your tongue.
Tight, and dynamite.
Okay, good job. The cranial nerve 12, the hypoglossal nerve, is intact. So next we would move on, if you'll move over here to get more leg room, to the motor portion. I would have you walk away from me. So if you'll take a few steps. Okay, that's good. And then I would note that your gait is smooth and has a rhythm to it, so that's good. And next I would have you walk heel to toe in front of me. Okay. Yeah. That's good. Okay, and there is a minimal swing, so a minimal swing has been noted. Next, I would do the Romberg test, and you would have your feet together, hands placed by your side, close your eyes, and normally I would assist the patient to make sure that they didn't fall, and that we would do this for 20 seconds. Okay, you can relax now. So there was no swaying, so the Romberg test is negative. For the sensory portion, I'll have you identify 2 different objects. Let me grab them for you if you close your eyes. Okay. If you'll hold out your hands. Okay. Does that feel sharp or dull?
Kind of like spongy.
What would you say it's typically sharp?
Kind of, yeah.
Okay. And then this one, does it feel sharp at all?
No,
Okay.
smooth.
Good job. So that was the sensory portion, and it is intact. And then next we would go to the deep tendon reflex, and I would do the bicep tendon. You can open your eyes, I'm sorry. Next I would do the bicep tendon. Okay. And do the reflex. Okay. And then next I would do the tricep tendon. Okay, good. And then next I would do the brachiodorsal tendon. Okay, and then if I'll have you sit right here for me, so I can do the patellar tendon. If you'll roll your hands for me. Thank you. Okay. Okay, good. Now if you'll stand back up for me. Okay. So the reflexes were 2+, so they were all normal, which is good. And then next I would do the superficial reflex. So if you'll curl your toes for me.
Just one?
Yeah, just one's fine. Okay, good. And that is the Babinski test. And your results for the Babinski test is negative, which is normal. And then now I would explain to you the Glasgow Coma Scale. It's the scale that I've been using through this assessment. It assesses the amount of consciousness over time. The lowest is a 3 and highest is 15. Below 7 is considered a coma, and I would give you a 15, 4 points for eye opening, 5 points for verbal response because you answered back to me, and 6 points for motor response, which is a total of 15 points, and that's why you would get a 15 on the Glasgow Coma Scale. And that concludes my